My name is Meg Pomke. I'm the chairman of the Stafford County Board of Supervisors. I'm speaking to you because I know the current situation with the coronavirus is scary for most people. For those of us in local government, this pandemic is unprecedented. Right now, the information changes on a daily basis and sometimes hour by hour. The president has declared a national emergency. Governor Northam has declared a state of an emergency. Yesterday, Stafford County declared a state of emergency, allowing us to be eligible for federal and state reimbursements at a later date related to the emergency, to access state mutual aids and lift certain procurement laws, allowing the county administrator to take necessary action. As well, it will provide the ability for local small businesses to apply for loans through the Small Business Administration. The president has asked all of us to do our part in slowing the spread of the coronavirus, pointing out that even if you are young or otherwise healthy, you are at risk and your activities can increase the risk for others. I want to emphasize that while no one should panic, everyone should take these directives seriously for the sake of getting our lives and economy back to normal more quickly. If you are sick, please stay home. If you can work from home, stay home. Avoid social gatherings of more than 10 people. Avoid eating at bars, restaurants, and food courts. Use drive-through, pickup, or delivery options. Avoid discretionary travel. Do not visit nursing homes or retirement or long-term care facilities unless you are providing critical assistance. Please wash your hands and practice good hygiene. If you have any questions about the latest on the coronavirus, you may visit our central coronavirus page on the front of our website at www.staffordcountyva.gov. We sincerely appreciate the public's patience and cooperation during this time of uncertainty, and we look forward to continuing to serve the needs of the citizens of Stafford County. Thank you.
Yes, Madam Chair. We'd like to give you and the citizens a full update on the activities that have been underway in response to this crisis. We have representatives, 3 experts here, folks from our fire department, which is the lead agency at the local level in responding to natural disasters and crises like this, Joe Cardello. And then we have representatives from both the health department, Wendy Lane, and from Stafford Hospital, Kathy Yablonsky. I'm going to provide you with a brief overview before those experts come up on the actions, priority actions that Stafford County has taken over the last few weeks in response. And I'm just going to provide you with a list of what we have been doing and then tell you the things that we're working on to keep you fully informed. First of all, we were one of the first counties to establish a web page dedicated to the coronavirus with links to federal and state agencies and are providing daily updates. And that's a great resource for our citizens. And you mentioned it earlier, Madam Chair. We were one of the first localities to open our Emergency Operations Center last Monday to be proactive on monitoring and planning for response. We began providing public notices and communication on February 27th with continuous updates through the entire month of March. We've enhanced janitorial services, increased disinfecting efforts significantly since February, including the distribution and display of proper health hygiene and practices to combat the spread of coronavirus throughout all of our facilities. We canceled all public events, programs, classes, and meetings through March 31st. We postponed all non-essential travel, training, and meetings for staff. We updated all of the county's continuity of operations plans. We implemented and are currently maximizing the county's teleworking policy. to reduce the number of staff in the building. Just yesterday, we issued a declaration of emergency to assure access to federal and state assistance funds, access to mutual aid, and revised procurement requirements to access pertinent resources. We're asking you today to approve that declaration as a board. We established revised sick leave policies, providing additional benefits for employees who are suffering from the virus or have been quarantined. We established travel guidelines and restrictions for county employees who have traveled or are traveling outside of the country. We began contact and clarification with federal officials regarding assistance programs, including business programs that have been mentioned today. We have been in contact with Senator Warner, Senator Kane, and Congressman Whitman about those programs. Those are still evolving. We established two-time-a-week meetings with the chair and vice chair to get input from board members as we move forward, as well as providing regular updates. We've implemented modified operations with our customer service areas to heightened social distancing measures for the public and for our own staff. We've established regular communication with the managers across the region and the state so that we can learn from each other on different measures to be taken. And we have scheduled and will host a WebEx on Wednesday, March 18th at 10 o'clock with representatives from the Virginia Department of Health and Emergency Management, Regions 2 and 7, for our regional community partners, giving them access to current information and the opportunity for questions and answers. Beyond that, we've provided regular communication to our employees and to you all, and obviously to the public through other means such as press releases. Some of the items that we have ahead of us that are on our plate, we are currently considering and would like your input on the closure of county facilities beginning tomorrow to public access. Our employees would continue to work and our residents would continue to be able to access county services online or by phone. And for essential services, departments will offer a by appointment assistance. If those folks will call us ahead, we could actually meet them in the building if they need a signature on a permit and those types of things. We would limit that to essential services. Staff will be reporting to the office unless they're taking advantage of teleworking. We would also keep our outdoor parks open. All the buildings, however, would be closed. We're currently evaluating the county's authority to restrict the operation of restaurants and bars. The county does have some authority in this area, and actually the city of Fredericksburg has just issued sort of an executive order on that. But we're going to look into that further. The governor has also taken some action today, of course. We're evaluating and projecting potential revenue loss and budget adjustments for the current fiscal year, and the same for the budget that is being reviewed going forward. We will give you some scenarios depending on the impact on the economy. We're considering restrictions on public meetings and hearings of the Board of Supervisors, as we've discussed today, and evaluating other ways to engage citizens through web-based meetings. We are also evaluating business assistance programs and communications, including potential web-based meetings to clarify federal and state assistance programs for the business community when we get that information. And we have already started a communication through our business-focused newsletter about the potential of that assistance from the federal and state agencies. And we're continuing our discussions with managers across the state, both our region in Fredericksburg, Northern Virginia, and even outside of that area. Those are the primary things that we've accomplished and the things that are ahead that we're working on. I will just mention briefly for the board, we are canceling the utility site visits that you all were going to take for this Friday. But I would like to go back because we'd like to see if there's any concerns, get your endorsement about closing the building until March 31st for public access. And as I mentioned, we will make provisions for essential services for citizens that may need to come in for some one-on-one work. But this is something that's being done by some other localities, and we certainly would appreciate your support and think it's appropriate if we're going to get serious about making a difference with this.
Okay, wow. Thank you, Mr. Foley. That was a tremendous list of everything that you all have accomplished in a short period of time. And thank you to staff. Thank you very much. Okay, with his last question, does anybody have an issue with closing the building and allowing appointments on an as-needed basis? Mr. Cohen?
No, I wholly support that. I think that's a very wise and appropriate and prudent move.
Okay, anybody opposed to that? Okay, I do have one question. If there are real estate transactions being conducted, would the clerk of the court be having similar permissions, if you will, regarding something like that? I mean, I would think that at some point there probably won't be a lot of transactions, but I'm sure there are some that are scheduled.
Madam Chair, we'll have to follow up with that. The judges had made some decisions about the courts, and I'm not exactly sure about the full level of services, but we would certainly coordinate with them to try to help the citizens.
Okay.
And I'll have to find out, though.
All right. And I know one of the other questions that a citizen had asked me was about car registration through DMV, and I'm sure there'll be some changes coming along there, some kind of a grace period for people.
Yeah, the state has just closed those offices, but they have said that they will give a grace period for folks whose registrations have run out and so forth. So that is in the communication from the governor's office.
Okay.
And we'll have links to that on our website so that folks can get informed through that resource. We may come back to you on some consideration of late fees and those types of things for our services as well. We just need to do a little bit more assessment on that first.
Okay. All right. Any other questions for Mr. Foley right now? No?
Madam Chair, we want to
Thank you.
move to the experts now, and Joe Cardello is going to lead off. And as I mentioned earlier, under state code, I'm considered the director of emergency management in this circumstance. The reality is, this is the guy who runs the local response to disasters. Typically, we're the lead agency on local disasters. That is not the case right now because of the healthcare issue that we're dealing with, but Joe's going to cover that for you at this point. Okay.
Thank you.
Good afternoon, Madam Chair, members of the board. Joe Cardello, County Fire Chief. Normally in an emergency, the EM folks and the fire and rescue personnel, we would be out on the street conducting damage assessments or getting information for sheltering folks if we needed to, or establishing sites to pass out supplies. But as Mr. Foley said, this is a completely different kind of emergency. This is a public health emergency, and we are not the lead agency. The local and state health officials are the lead agency. So what we are doing, and I think we've done a great job of getting prepared. That is our sole focus at this point, is gathering information and being prepared, waiting for in the event that we have to take some kind of action. We have, I think it's important to also let you know that we do have an emergency operations plan, and it's required by law, and we train on it frequently. And exercising that plan and implementing that plan is part of normal business. As Mr. Foley said, the Emergency Operations Center is open. It's been open for a couple of weeks, and it's on the monitoring level. That means we're there during the day, Monday through Friday, 8:30 to 4:30. This allows for increased monitoring and development of situational awareness around the region and around the state. And our activities focus on collecting, analyzing, and disseminating information and conducting appropriate contingency planning. In that EOC every day are representatives from Fire and Rescue, Sheriff's Office, VDEM, sometimes VDOT stops by, BDH, and we work together with them and our other partner agencies to determine the scope of the incident and what our current and future needs and plans might be. Other things that we've done recently, we developed a draft pandemic response plan that's being reviewed. Somebody had a question earlier about what have we requested through the state. We have requested meals for first responders, and we've also requested certain types of personal protective equipment. I think it was masks and gowns were the specific request. Other mitigating actions we're taking at a fire and rescue department level, we've implemented shift conference calls, which are every morning, so that information gets passed on quickly and from one source. All volunteer chiefs and presidents and career officers are on the call every morning, as well as command staff. Our dispatch procedures, this is very critical. We have rearranged our dispatch profile and our procedures in this emergency to help limit exposure and get more accurate information from 911 callers. Now the dispatchers and call takers, they will ask certain questions related to travel history, related to signs and symptoms, and they will even, they are now starting to ask every person who calls, no matter what the problem is for, if they have been exposed to anyone with COVID-19. In addition, they will ask all people who meet the criteria for COVID-19 to wear a face mask if they have one and meet us outside if they're able to. Those things, along with on certain calls, we are not sending as much. Even though we have scaled back in the last 6 months, we're scaling back even further on certain calls to make sure that instead of infecting an engine crew and an ambulance of 6 total people, maybe only 2 people go in and the rest wait outside. We have canceled all travel and training activities until further notice. The only thing that we are continuing is daily company level training because that's important for us to be sharp and ready. And we have also said that crews should stay in their stations. They shouldn't be driving around visiting other stations. We've canceled station tours and public activities, so we have a lot of groups come in from time to time at different stations to want to tour and want to have different programs. We've unfortunately had to cancel all that until further notice. We've developed, we talked about this earlier, we developed and distributed a staffing plan in the event that we lose multiple people to quarantine. And the last thing, one of the last things we did yesterday was effective immediately. No one will be allowed to put in for leave from this point forward until we figure out how bad this is. People who have scheduled leave are still going to be allowed to go, but we have, no one can say, hey, next week I want a day off and be allowed off. We're going to kind of hold everybody here for as long as we can. We've been in contact, as I said, with our VDH and partners to develop procedures on how to respond to and care for and decontaminate after an exposure when we transport a patient. And that's using the latest information that's available from VDH. And we distributed that every day to our personnel. We have an update. As someone mentioned, it changes frequently. We have been in touch with the county risk manager to inquire. Someone had a question about workers' comp. We heard back from the insurance company. It's going to be treated like any other injury or claim. We're going to submit it, and it's going to be up to the insurance company whether or not to honor that claim or not. We are looking into potential quarantine housing. We've identified a facility that will house a small number of people. So we're going to continue to look into that and make sure that that's ready to go in case we need it. And we are working to provide food or access to food for our personnel, our first responders, our folks, the sheriff's office and the dispatchers who are going to be at work for 24 hours. And if you've all seen the grocery stores lately, you know it's tough out there. So we worked with Mr. Holden in economic development, and he has been in touch with several of the local grocery stores to see if we can have at least access at some point during the day to a grocery store for our people on duty. And in closing, I'd just like to say that right now in the EOC, there's fire and rescue personnel, sheriff's office personnel, there's a representative from VDH, and our CERT volunteers are over there. And they're over there every day, and they're doing a fantastic job of monitoring everything and making sure that we're in compliance with federal and state regulations with reporting and tracking, and they're doing a fantastic job, and I'm really proud of the effort of all of them. If there's a message that we would like to convey, it would be of the importance of personal hygiene, respiratory etiquette, frequently disinfecting and cleaning surfaces and anything that you touch a lot, social distancing, and as many of you have said, staying home, especially if you're sick. And like Ms. Allen, I'd like to echo the concern we have for some of our senior population who may not be able to get to a grocery store as frequently as any others. And like I said, we all see in the condition of the stores. So instead of hoarding some of those supplies, maybe save some for others, because I know that our older folks are having a more difficult time, so we all need to treat them with compassion and maybe save some of those supplies. So is there any questions on any of that?
Any questions for Chief Cardello? Ms. Allen?
I just want to say before I start, thank you so much for your leadership in this difficult situation. I know for you, you've got to be extremely stressed out, but you don't show it. So thank you for that. I just have 3 questions. So the first one is, you had mentioned with the 911 calls, should this mushroom, do we have the capacity to be able to handle all those phone calls? And if not, I mean, how do we get that capacity? I mean, I don't even think we can, but I'm just curious.
I think we have the capacity to handle a great deal of calls. And we just this week started tracking our calls, and there's not been a spike yet. So, but we haven't obviously seen a peak in this entire emergency yet. It's hard to answer that question as to whether, what is the capacity that we have. So I can work to monitor that and keep you updated through either PSC or the board meetings.
Okay. And then the second question is, I guess since we've never experienced something like this before, how are we using this situation to create a roadmap for future pandemics or epidemics?
As I stated, we have created a draft pandemic
that you're
response
gonna-
plan,
okay.
and that's being reviewed right now. We also, by law, our emergency operations plan has to be updated every 4 years. It was done in September of 2017, so we're almost ready to start getting that together. So this gives us an opportunity to look at all of those things and make sure they're updated and that we're ready for anything that happens.
Okay, and then the final question is, and this is just for what if, should the situation mushroom out, right? Like we get a bunch of calls, do we have the equipment to sanitize our medical vehicles as we're transporting patients in the future? I'm just curious.
So as things stand today, we have the capacity to disinfect everything that we have. Projecting forward, if we lose a lot of people and a lot of vehicles, it's hard to kind of predict. I think we're in good shape. We've ordered things that we need, that we know we're going to need, and we've also begun tracking things every day. We have a level of supplies that come across through email every day, so we know where we stand. The EOC is tracking that, and they're going to reach out to state and federal resources to make sure that we don't get to the very end of our supply before we ask for some.
Thank you.
Any other questions for the chief? Okay, I have an idea. I'm just going to put it out there as you're standing there talking. As you know, we're trying to protect the greatest generation of America. And if your parents were like my parents, they all have so much pride. Is there a way that they could call the 911 center and they say, I don't have enough food? They may not have friends. Their relatives may be out of state. I need help with groceries. Could that information be disseminated out to staff and then maybe to elected officials that have we all have Facebook pages, so that we could reach somebody in our local community that could help that person out based on where they live? It's just an idea.
No, thank you. I don't think the 911 system would be the place for that.
Okay.
I think there are other mechanisms that we could establish. I think the 311 line is still
Absolutely.
available to us. So there are things that we can do, and we will certainly talk about in the coming weeks being able to set up some kind of resource like that for our senior populations.
Yeah. Ms. Allen?
Can that extend to medications? Because I know for some seniors, they can get to the drugstore,
Right.
especially if they're being quarantined or being told to self-quarantine.
I'll look into that.
Okay. Thank you.
Yes, Madam Chair, we have representatives from the Health Department at this point.
And while they're coming up, I did want to just let everybody know that I did neglect to mention that we postponed the library presentation and the National Procurement Month presentation due to the fact that we wanted these other presentations today. Thank you and welcome.
Thank you. Good afternoon. I'm Allison Balmas-John. I'm the Population Health Coordinator with the Rappahannock Area Health District.
And my name is Wendy Lane. I'm the Local Health Emergency Coordinator. And I just want to say it has been a pleasure serving in your Emergency Operations Center with all those men and women. They're good people.
I think we just saw you at the George Washington Regional Commission meeting
you
last
did.
night.
Well, we've been trying to get the information out to everyone. I think a lot of our talking points have actually already been addressed today, so we'll touch on them a little bit more just to emphasize, but kudos to you all for doing your homework. We recognize that there is a lot of misinformation that is out there, and the more that we can get the true quality information out and into the community, the better. So thank you all for that. As of today, there are 67 positive cases of COVID-19 across the Commonwealth of Virginia. We have 2 cases in Planning District 16, one that was detected in Spotsylvania on March the 9th, and then one here in Stafford that was detected on the 15th. So far, there have been 2 deaths statewide. As background, when we at the Rappahannock Area Health District receive a positive case, the positive test results, we do contact tracing for that individual to everyone that they have been in contact with for an extended period of time, being defined as within 6 feet for 15 or more minutes. So we reach out to all of those individuals and do ask them to self-quarantine. We make an assessment of whether they are considered a high or a medium risk, and then in accordance with whatever risk assessment we reach, they are reporting their temperature to us either daily or on the 1st and 14th day of their quarantine, and are asked to keep us appraised of any symptoms that they have. So that contact tracing is taking place for both of those cases. We do have other test results that we are still awaiting. So as has been mentioned, this is a fluid situation. More information will be forthcoming when we receive those test results. As has also been mentioned, the governor's office did release an update this afternoon just before we were leaving the office to come to this meeting. That guidance asks that we are avoiding non-essential gatherings of more than 10 people to stay in line with the federal guidelines that the president announced yesterday. There's a lot of numbers that have been floating around. Over the weekend, the CDC did advise that we are not having gatherings of more than 50 people for the next 8 weeks. So just as we are starting to think about timelines, we should still be following the governor's guideline of no more than 10 people, but also starting to think ahead. Other points that were in that governor's update: adults age 65 and older are requested to self-quarantine. And then there are some additional outlines for increased social distancing measures, particularly affecting restaurants, fitness centers, and theaters, to reduce their capacity to 10 patrons or less. There is extensive guidance available on both the Virginia Department of Health website as well as the CDC. We're considering those to be the best sources of information that we're referring the public to. There is information available to specific groups. So I know that a lot of people are checking the VDH website just to get a sense of what the numbers currently look like, but know that if you open some of the tabs that are available there, there is ongoing guidance available specifically to schools, to businesses, and to other community partners. There is also some information that may be timely as in regards to proper cleaning and disinfection. So as we are looking at things like county buildings closing, there's some strong guidance out there about how that disinfection process can take place. And I think with that, I will pass it over to Wendy.
You all may not be aware, Dr. Rossheim is our area health director, but he is out. He is, I'm going to say it again, he is ill, but not with COVID-19.
Right. Could you pull the
he-
mic down, please?
Oh, I'm sorry.
Yeah, just so people at home can hear. Thank you.
So he is out ill, and we have an acting health director. Her name is Dr. Denise Bonds, and she is the health director of the Thomas Jefferson Health District. So she is in and out helping us, and actually tomorrow VDEM will be settling in at our office on Central Park Boulevard, and they will be helping us with an IC structure there. So that will give us a little bit of a hand, because as you can imagine, we are a little overwhelmed. All the health district clinics that we have right now in our 4 counties in the city of Fredericksburg are open for 36-plus week maternity cases and WIC appointments, and I think our STD clinic is still open, but it's on an appointment-only basis. And we, as of today, are going to start using the parking lot as our waiting room. So when they get there, they will text, I'm sure you've heard of this, and then the person will come out when it's time for their appointment and let them in the building. So we do have the event scheduled tomorrow, which was mentioned earlier at 10 a.m. Dr. Denise Bonds will be there, as will Allison, myself, and our two Virginia Department of Emergency Management representatives. Preventative measures, you guys have really already covered this. You read them all. I can't add anything to it. Hygiene, stay home, social distancing, all of that. We can't, I guess, urge that enough. Yeah, we can't. So anyway, I think that's about all we have. You guys covered most of it for us. We kept looking at each other going, hey. So any
Okay.
questions for us?
Yes, any questions? Mrs. Allen?
Thank you. So I guess I have three questions again. I don't know, so three. And so how quick is the test turnaround between testing someone for COVID and when you guys get the results to know? Because
Right now is what's happening is they're going by carrier every day to the state lab, and then we receive the results the next day. We usually know in the morning when we have a briefing, we kind of get together and go over what we have. If we've had any test results come back, 24 hours would be the answer right now.
okay. And then
I will clarify, that is for the state testing that's being done
Right.
through DCLS. The private testing that is now available through LabCorp and Quest Diagnostics, that is separate from the state. I can't give the exact time frame of what those tests, that time frame for those looks like.
Could you please identify for those people at home, DCLS, what that acronym
Yes.
stands for?
I will do my best. Division of Consolidated Laboratory Services, I believe is the acronym.
Okay, thank you.
You're welcome.
and then the second question is the amount of tests we have that the state, not private, that the state has.
We do not have an answer for you, a definitive answer. We know that we are getting tests every day. They're just flowing in. And remember, we started out with very few, and now that we have the private sector in with us, we are getting more and more and more. So it's just an influx right now, so there's not a perfect number I can give you.
Okay.
But we have enough.
All right, and then, so you were saying that you guys are checking when if someone's tested positive, you guys figure out within 15 minutes or whatever who they've been around. You said, what did you say, how their point of contact with someone else?
The contact tracing?
Yeah, how far do you guys go back, just like secondary, tertiary?
You can answer that better than
I'll do my best. We track anyone that they've been in contact with for more than 15 minutes for the last 2 weeks. That varies a lot person to person. If somebody is, say, not currently working, that may just be their immediate family. If somebody works in really close proximity to folks at their office, that number may be a lot larger. This is one of those reasons that we're really urging people to stay home. It really minimizes those number of contacts that somebody might have. But yes, we're looking back 2 weeks.
And do we even have the manpower to potentially even follow all of that out? If someone didn't know and they're walking around and, being a carrier, has the virus and just
We're doing the best that we can, and if we asked you, who have you been within the last week, can you name everybody? What stores did you go into? So just think about it. That's why we're saying stay home.
Well, I was just asking
And,
to highlight that point of people so they
it-
know to stay home because it's hard to track.
And we're also asking that about, making sure that our information is correct, because if we get false information, we use those resources to go and look for that positive case that somebody says, oh, is over here. And if there's no positive case over there, if it's not a confirmed case, then we're just wasting manpower and resources tracing that down. So you can imagine, it's a huge job for our EPI team.
Thank you.
Thank you.
Mrs. Vanuch?
You guys did a wonderful job of talking about how to avoid getting COVID-19 and the precautions that we can take. One of the questions I think is very important for our constituents to understand, let's say somebody is experiencing some of those symptoms that the CDC outlines. What should they do right now?
Right now, our advice, right now, our advice to people, if they are showing symptoms, and if it's just, a regular cough, stuff like that, then we're saying treat yourself just like you would. We can only treat the symptoms anyway. There is no cure for COVID-19. So we're going to treat the symptoms. If you have a fever over 100.4 with a dry cough and with body aches, then we would want you to call your healthcare provider, and before you go to the hospital or before you go to his office, call, because there's special precautions that need to be taken by the healthcare workers before they see you.
Okay, thank you.
I will add that at this time as well, if you are showing symptoms, you likely will be screened for things like the flu before you are able to get a COVID-19 test.
Any other questions? Okay, I just have one, so people understand, because I didn't understand this at the beginning. So the test kits are not physically here, correct? So you are swabbed, and then that information goes down to Richmond.
Correct.
To be tested, and then that information is sent back to your office. At what point, do you have any information on when those test kits that are currently in Richmond might be disseminated out? And you may not have that intel yet.
I do not. I do not have an answer for that question, but that is certainly something that we will continue to monitor. But you are correct that right now the swabs will be collected. If they are going to the state lab, they are sent to Richmond. If they are going to a private lab, then they're still collected by the doctor and then sent to that lab.
Okay. All right. Okay. Great. Thank you very much for coming and joining us today.
Of course.
Get Tom's attention. And now we just have some short comments and presentation by Kathy Yablonsky with the Stafford Hospital.
Thank you, and thank you, everybody, our Board of Supervisors, Mr. Foley. First, I want to start with thanking our community, thanking our leaders, thanking EMS, and thanking our Sheriff's Office. This really takes a village. There's not one person that can manage this. It really does take everybody working in coordination, and I have to tell you, Stafford County does that, and I do appreciate and would like to thank our chiefs and our Board of Supervisors and Mr. County Administrator Foley for your support. What I would like to just give a quick update is our...
Oh, Kathy, can you please just pull the mic down a hair? Thank you.
There you go. What I'd like to talk about is the planning that we've done for Stafford Hospital. As our healthcare organization, we plan and train for a variety of different scenarios, including a pandemic response that would likely or potentially could strain our healthcare system and force us to make decisions outside of standard. We have plans. We've always had plans. What we do now is we take the plan that we have and look at the circumstances that are around us, and then making those plans appropriate for the response for what's happening either today, tomorrow, or weeks from now. We do not do this alone, as I said. We partner with our law enforcement, first responders, regional state agencies, and the Northern Virginia Health Alliance, making up the community of hospitals and emergency responders working together to plan for situations like what we currently find ourselves in. By preparing, we do have the framework to respond to the scenarios with the flexibility to pivot when circumstances require, and we're working within that preparation framework and confident in our response. Our health system in response has also changed our visitation policy, in which we are not allowing visitation at the hospital. We feel that's the most responsible thing to do for our patients who are already sick and we don't want to inhibit their care. We will, though, still, if there's a laboring mom will be able to have a designated support person during that laboring time. And also for patients under the age of 18, they would be allowed to have their guardians with them. We feel that this is the most prudent response for making sure that our community stays safe. And of course, in different situations would have to be evaluated. Our team and our hospital health system has created a multidisciplinary team that's meeting regularly. It's including physicians, clinical team members, operation team leaders, to make sure that we're constantly reviewing the information that we have and making sure that we're making those changes to the policy or to practice as needed, but also preparing for the future, that if we know something could potentially, making sure that we have all the pieces in place so that we can take care of our community. We are very lucky. Stafford Hospital is also part of Mary Washington Healthcare, so we have the support of both Mary Washington Hospital and Stafford Hospital to make sure that we're caring for our community in the best that we can in the situation that we have at hand.
Great. Thank you very much. Any questions for Mrs. Jablonski? Mrs. Allen?
Thank you. I have 3 questions again.
I was going to say, do you have 3?
I'll go 3. I just want to know, okay, what are the amount of, I'm not sure if you're allowed to tell us this, but I'm just going to ask, what is the number of ICU beds that Stafford Hospital has?
We actually are licensed for 6 ICU beds.
6?
6.
And so
But our surge planning does support increasing as necessary. That's part of our planning, is that we have a surge plan that would look at other opportunities or other areas potentially, but then also working in partnership with our health system.
So if we're supposed to, if we have to scale up,
We have the ability to scale as necessary.
to however much number we need.
I
Okay.
can't,
Yeah.
I think it would be irresponsible for me to say that, just because this is a fluid plan and we would have to move as necessary. So I don't want to give a number, because that might change. What I can tell you is we are licensed for 6 beds, but of course our surge planning has created other opportunities for us if that is the need.
Okay, and then, would that be the same thing for respirators and ventilators, whatever
Correct.
you need? Okay, and then the final one would be, how are you able to still meet the needs of other critical ill patients that are going to be requiring
Still
medical
coming in.
attention?
And that's part of our planning, because this isn't just taking care of the pandemic, but it's also taking care of our community as a whole, because we still have patients that are coming in. We still have flu in the air, in our community. So our plans both take into consideration both the patients that we would typically have, and then what that would look like in the surge plan. And that's where you come together with determining the needs of what would be, best for us to do as a hospital.
Mrs. Shelton?
Ms. Jablonski, I actually wasn't going to thank you, but I will, because I have a child that's in the hospital right now, and I thought I'd speak to it and give some comfort to people, because one of the things that I wasn't aware of is that Mary Washington provides sitters, and these are highly trained individuals who watch over your loved ones when you can't be there. And so in my particular case, because I'm a visitor and my autistic son is in the hospital without me, I've noticed for the last 5 days, there's very qualified individuals, very caring individuals that are watching over Stephen as we speak. And for those that want that level of comfort, I can assure you that it's a very awesome resource. And thank you so much for being able to do that for us.
Absolutely. We're very lucky as a community to have the healthcare system that we have, and I'm glad that you feel confident with the care that we're providing.
Okay, with no other questions, thank you very much,
Thank you.
Mrs.
And thank
Jablonski, for coming, and we're all in this together.
We absolutely are. Thank
All
you.
right, take
Thank
care.
you.